When you are pregnant, right, your cervix, which is the entrance of your womb, stays tightly closed to keep the baby in the womb. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. O. I'm always excited to be here to discuss about pregnancy because pregnancy is a beautiful thing, and this show is all about pregnancy. If you are a pregnant mom, pregnant dad, anyone who just loves pregnancy or just wants to know more about pregnancy, then this is the right show for you. Today, we're going to be talking about signs of labor. So if you are new to this pregnancy game, you might be wondering, how am I going to know when I'm in labor? Some people are so anxious, how do I know when I'm in labor? Start to panic and all that. So relax. That's why I'm here for you. Your pregnancy partner is here to put you through this pregnancy journey so there is no surprises. If you are wondering, how would I know when I'm in labor? What are the signs? What are the changes? How am I going to figure out that I'm going to go into labor or that my body is in labor? Just pause, take a deep breath and relax, because I'll be taking you through a journey and telling you 3 guaranteed ways to know you're in labor. The number one way or one guaranteed way of knowing that you're in labor is bloody show. Bloody show is this blood-tinged mucus, that your cervical mucus that you see every month during your ovulation period. This time it has a little bit of blood in it, and the amount is just a little bit more than that, right? So that's pretty much what bloody show looks like. It has its cervical mucus mixed with blood. So let me explain how it happens, right? Because some new moms might go to the toilet, just imagine you went to the toilet, you went to use the bathroom, and then you just pull down your underwear, and all of a sudden you saw bloody mucus. Some new moms might start panicking, oh my God, what's happening to me? Is my baby okay? Is everything fine? No. When you see bloody mucus, there's nothing wrong with you. Your baby is fine. As long as you are already, full term, right? 37 weeks upwards. So 37 weeks is early term, and full term is 40 weeks and above. So as long as you are already 10, let me just put it that way, right? You don't have to panic. The only time you should panic is if you are still in your second trimester and you're seeing bloody show, because then that means that you're going into preterm labor, which is what we don't want. I'm talking about that in other episodes, which you should definitely look out for. But for today, we're focusing on signs of labor at full term. When you see bloody mucus on your underwear, or maybe when you go to use the toilet and you wipe down and you see bloody mucus, you don't need to panic. That's a good sign. It means that the baby is actually coming. All these months of pregnancy, have you noticed that when it gets towards the end of your pregnancy, you just suddenly start to get tired? You're like, can this pregnancy be over already? Well, bloody mucus is a sign that this pregnancy is about to be over, because baby will be coming really soon. When you are pregnant, right, your cervix, which is the entrance of your womb, stays tightly closed to keep the baby in the womb. For your baby to be able to come out, for your baby to be born, the cervix actually has to open up to allow the baby pass through. Now, the act of this cervix opening up is what we call in medicine cervical dilatation. When your cervix begins to open up, that is a guaranteed sign that you're already in labor and the baby is coming soon. Now, imagine that all through your pregnancy there was a mucus plug there in your cervix, just closing up the hole. And what does that mucus plug do really? It's forming a barrier. It serves as a barrier to protect the baby from all sorts of infections. Now, if there was a mucus plug in this tiny hole, by the way, the hole is so tiny that it's really difficult for even a pencil to pass through. When this hole begins to get wider, what do you think will happen to this mucus plug that was there? It will definitely fall through the hole. And when it falls through the hole, where will it land? Of course, it will land on your underwear. And that's the bloody show you see. So some women see a big blob of blood on their underwear, while some it comes down in triples. Whichever one, once you see bloody mucus, it's a sign that you are in labor. You need to differentiate between bloody mucus and bright red blood, because they are two different things and they mean different things. If you see bloody mucus when you are full term, when you are early term, that's okay, means your body is in labor. But if you see bright red blood, no mucus, just blood, then this might be a danger sign. It might be a sign that something is wrong with the baby and you need to get to the hospital immediately, as soon as you can, okay? If you're a veteran mom, you already know that when you're in labor, when you go to the hospital, the doctors will be doing something that we call a vaginal examination, and what they're just doing is just checking how wide the cervix is, right? The maximum size or the maximum diameter or width that the cervix gets to for a baby to be able to pass through should be 10 cm. When the cervix is not up to 10 cm, it's not safe for you to push your baby. The cervix must get to 10 cm for you to be able to push your baby. So when a doctor is doing a VE, they're actually checking how wide the cervix is. They're also checking other things about the cervix, which we'll talk about in other episodes. That is not a discussion for today. How soon after you see this bloody show is your baby going to come? Because some people say, hey, Dr. O has said you see bloody show, you're in labor, therefore I've seen bloody show, my baby is going to come out next minute. No, it doesn't work like that. When you see bloody show, it depends on your body type. For some women, it could take days after the bloody show for their baby to come. For some, it could take hours, right? It just really depends on you. But one sure thing is that baby is going to be here sooner than later, and it's a good idea when you see bloody show to go to the hospital to get checked. If the doctor feels like, okay, you're going to go into active labor very soon, then they'll tell you, okay, stay back, let's wait for baby to come. But if they feel like, you still have some time, they might tell you, go home and come back in 24 hours or something like that, right? Depending on how wide your cervix is when they do a vaginal examination, like we discussed. So keep that in mind. When you see bloody show, go get checked and let's know how soon baby is coming. But the next guaranteed sign of labor, this one, all movies have abused this sign. In fact, this is like almost the only sign of labor that they know in movies for whatever reason. Someone needs to tell movie people that, there's more labor than contractions. The way they do it in movies is, if you want to see when a pregnant woman is going to give birth, immediately she's already having contractions, screaming, shouting everywhere. No, that's not how contractions happen. Sorry to burst your bubble. Movies have been lying to you since 1956. This is how contractions happen. Contractions, they feel like painful menstrual periods. You know those menstrual periods where they're so painful and you have to take pain relievers, but just so that you can be normal at least. Now, contractions feel exactly like that. The only difference is that they get more intense and more painful with time. It will get so painful that you will feel like your head is about to explode. So let me break it down for you. There are real contractions and there are fake contractions. And as a new mom, you may not know the difference. As a veteran mom, you may know the difference because if you've given birth before, I'm sure you cannot forget what a real contraction feels like. But for the sake of new moms, because this show is both for new moms and veteran moms, like I always say, let me tell you how to differentiate between a real contraction and a fake contraction. By the way, fake contractions are called Braxton Hicks. A real contraction is regular. So you can have one in 10 minutes, one in 8 minutes, one in 5 minutes, but the point is, it's going to be regular. So it can come like every 10 minutes. Next 10 minutes, you have another one. Next 10 minutes, you have another one. Or next 8 minutes, you have another one. Just like that. But fake contractions, you can have one now. The next one will come in the next 1 hour. The next one will come 3 minutes later. The next one will now come 20 minutes later. So you just know that one is fake. Number one sign. Number two, real contractions, they increase in intensity. So this means they get more stronger with time and they are more painful as they progress. If you're having a real contraction, especially if you are someone that is really thin and you easily see your bump, right? When you're having contractions, you will see that your tummy is getting harder. It's hard like a basketball. If you know how hard a basketball is when it's fully pumped, that's how your tummy is when you're having really strong contractions. Like if you touch your tummy, it literally feels that hard and looks that hard, right? When the contraction goes, the tummy now goes back to the usual soft state. So when you touch it, it's soft as usual. But when you're having the contraction, it's really hard, and you can literally see when the tummy is soft and when the tummy is hard, especially if someone that is really slim, right? Fake contractions, they don't increase in intensity. They don't get more painful with time. In fact, chances are they're not even painful at all. You're just feeling it, but there's nothing really. So if your contraction with time is not increasing in intensity, it's not getting stronger when you touch it, it's not getting more painful, then what you're having is a fake contraction. That is child's play. No real contraction is going to feel like that. Okay, that's number 2. Then real contractions, apart from being regular, are going to increase in frequency. So for example, if you are having one contraction every 10 minutes, with time you start to have one every 8 minutes, then maybe one every 7 minutes, then one every 6 minutes, 5 minutes. So basically it starts to get more frequent as time goes on, right? But one thing you should know is contractions are never continuous. You're not going to be having a contraction and it will never stop. No. If you have it, it could last for like 60 seconds approximately to stop, to give you time to catch your breath. Then maybe in another 5 minutes to come back again. So when you see that your contractions are becoming more frequent, that's a good time to rush to the hospital, because it means that the baby is closer. What exactly are contractions? Contractions are your womb squeezing itself to push the baby down the birth canal. So just imagine that your baby is inside the womb and the womb is squeezing. It's like toothpaste when you're trying to squeeze toothpaste out of the tube. So the womb is trying to squeeze your baby down the birth canal so that the baby can come out and come and say hello to you. So that's basically what contractions are. So when the womb is squeezing, that is the contraction, and that's the time you feel it. And that's why doctors always tell you when it's time to push, that push with the contraction, because the contraction is pushing your baby down. So when you also apply your own force, the baby comes out successfully. And the last thing I wanted to mention is that real contractions, they don't change with changes in your position. They remain constant. So for example, if you're having a full contraction, if you are sitting down, if you stand up, the contraction might stop. Or if you are lying down, you sit down, the contraction might stop. But you see real contraction. Whether you are sitting, whether you are lying down, no matter what you do, the contraction remains the same until it is ready to stop. Okay guys, so we've talked about 2 guaranteed signs of labor and we're left with just one more, but we're kind of running out of time right now. And you know, like I always say, we moms tend to have a short attention span, or we pregnant women, maybe we're having cravings or something, you know. So I need to stop the video now. We'll talk about the final one next week. Yeah, I like to keep you guys in suspense. Make sure you don't miss it. Like I always say, every pregnancy might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.